Hi, so today I'm interviewing some doctors and experts from the University of Harvard who are studying infectious diseases. So, who am I talking to today?
I'm expert Creutzfeldt-Jakob.
I'm Dr. Carly Coleman.
I'm Dr. Sophia Garau.
And so, what is the name of the disease we're going to be talking about?
The disease we're talking about today is Creutzfeldt-Jakob Disease.
And what is the disease infecting?
The disease is caused by prions. Prions is a protein found throughout the body and is most abundant in the nervous system. Prions that connect to normal proteins can cause the protein to misfold, which then leads to disease. If the abnormal shapes are formed in our proteins, then abnormal proteins clump together.
And so, what are some of the signs and the symptoms of this disease?
Early symptoms include things such as lack of coordination, impaired thinking or memory, behavior changes, insomnia, unusual sensations, and changes in vision. As this disease progresses, the symptoms can go as far as weakness in arms or legs, blindness, loss in ability to move or speak, can lead to other infections, a coma, and eventually leads to death.
Are there any long-term consequences of having this disease?
Since CJD is a disease that affects our brain, the symptoms are always quite severe whenever someone gets this disease.
And is it treatable or curable?
There is no cure for this disease. Currently, some medications are given to try and ease the pain and symptoms, but that is as far as treatment goes for this disease.
Is it preventable? And if so, how can it be prevented?
There is no way to prevent this disease. Majority of cases appear sporadically and develop very quickly. Sometimes it can develop from inheritance, or in the rare occurrence, it can develop by contamination through beef or medical procedures.
And why is your team interested in addressing this problem?
We're interested in addressing CJD because we feel as if it is a disease that not many people know about yet. We feel people need to be more educated on this topic so that if they were to have any of these symptoms related to this disease, they would know to go get help right away.
What is your target audience you want to educate?
Our target audience is the older population. Study shows that 60-year-olds is when CJD typically affects people. So knowing about this disease a few years ahead could benefit so that people know the signs to look out for. It feels most important to educate the population that this disease would be affecting.
Why do they need to hear your message?
People need to hear our message because CJD is not a disease to be taken lightly. It is a life-altering, if not life-ending, and everyone should be very well educated on it in case it happens to you or one of your loved ones.
So what's the overall message that you want to convey today?
We want people to become more aware of this disease since not many people know about the disease since it's very rare, but the goal is to inform people about the side effects since they are so severe.
And what are some key things that people should know about this disease?
CJD has a lot of unknowns about the disease, but if you suspect you have symptoms and signs, getting tested is best to know for sure. CJD can be acquired genetically, environmentally, and sporadically. There is not much we can do to prevent the disease, but understanding its signs and how to acquire it can be important for potential prevention.
All right, thank you everyone for coming to this interview and informing the public about this very infectious disease.